with concrete measures we can take to prepare for an influenza pandemic. Today, I'm announcing key elements of that strategy. Our strategy is designed to meet three critical goals. First, we must detect outbreaks that occur anywhere in the world. Second, we must protect the American people by stockpiling vaccines and antiviral drugs and improve our ability to rapidly produce new vaccines against a pandemic strain. And third, we must be ready to respond at the federal, state, and local levels in the event that a pandemic reaches our shores. To meet these three goals, our strategy will require the combined efforts of government officials and public health, medical, veterinary, and law enforcement communities, and the private sector. It will require the active participation of the American people. And it will require the immediate attention of the United States Congress, so we can have the resources in place to begin implementing this strategy right away. The first part of our strategy is to detect outbreaks before they spread across the world. In the fight against avian and pandemic flu, early detection is our first line of defense. A pandemic is a lot like a forest fire. If caught early, it might be extinguished with limited damage. If allowed to smolder, undetected, it can grow to an inferno that spreads quickly beyond our ability to control it. So we're taking immediate steps to ensure early warning of an avian or pandemic flu outbreak among animals or humans anywhere in the world. The second part of our strategy is to protect the American people by stockpiling vaccines and antiviral drugs and accelerating development of new vaccine technologies. One of the challenges presented by a pandemic is that scientists need a sample of the new strain before they can produce a vaccine against it. This means it is difficult to produce a pandemic vaccine before the pandemic actually appears. And so there may not be a vaccine capable of fully immunizing our citizens from the new influenza virus during the first several months of a pandemic. To help protect our citizens during these early months, when a fully effective vaccine would not be available, we're taking a number of immediate steps. Researchers here at the NIH have developed a vaccine based on the current strain of the avian flu virus. The vaccine is already in clinical trials. And I'm asking that the Congress fund $1.2 billion for the Department of Health and Human Services to purchase enough doses of this vaccine from manufacturers to vaccinate 20 million people. I'm asking Congress for $2.8 billion to accelerate development of cell culture technology. By bringing cell culture technology from the research laboratory into the production line, we should be able to produce enough vaccine for every American within 6 months of the start of a pandemic. We must ensure that all levels of government are ready to act to contain an outbreak. We must be able to deliver vaccines and other treatments to frontline responders and at-risk populations. So my administration is working with public health officials and the medical community to develop effective pandemic emergency plans. We're working at the federal level. We're looking at ways and options to coordinate our response with state and local leaders. I've asked Mike Leavitt, Secretary Leavitt, to bring together state and local public health officials from across the nation to discuss their plans for a pandemic and to help them improve pandemic planning at the community level. I'm asking Congress to provide $583 million for pandemic preparedness, including $100 million to help states complete and exercise their pandemic plans now, before a pandemic strikes. If an influenza pandemic strikes, every nation, every state in this union, and every community in these states must be ready. To provide Americans with more information about pandemics, we're launching a new website, pandemicflu.gov. That ought to be easy for people to remember. Pandemicflu.gov. The website will keep our citizens informed about the preparations underway, steps they can take now to prepare for a pandemic, and what every American can do to decrease their risk of contracting and spreading the disease in the event of an outbreak. To respond to a pandemic, members of the international community will continue to work together. An influenza pandemic would be an event with global consequences, and therefore we continue to meet to develop a global response. We've called nations together in the past and will continue to call nations together to work with public health experts to better coordinate our efforts to deal with a disaster. Now, all the steps I've outlined today require immediate resources. Because a pandemic could strike at any time, we can't waste time in preparing. So to meet all our goals, I'm requesting a total of $7.1 billion in emergency funding from the United States Congress. By making critical investments today, we'll strengthen our ability to safeguard the American people in the awful event of a devastating global pandemic. And at the same time, we'll bring our nation's public health and medical infrastructure more squarely in the 21st century.